A 5 on Your Side health investigation is revealing new information on tests and screenings commonly prescribed by your doctors.
But are the tests as effective as they should be?
Consumer advocate Jonathan Walsh has been digging into this for you. And Jonathan, there are a lot of doctors now saying that sometimes less is more when it comes to certain testing.
Consumer Reports has done an extensive study on the questions you should ask your doctors and the screenings to get and to avoid. On Your Side tonight, we go looking for answers from doctors with a group called Better Health Greater Cleveland and tell you that legal experts say, be careful.
My mom started getting repeated sinus infections.
6 to 8 months of antibiotics did not cure Christine Martini's 72-year-old mom. In fact,
After she received so many antibiotics, she ended up being in a far worse situation.
Christine's mom ended up with a massive fungus in her sinus. An infectious disease specialist determined it was C. diff, an often fatal infection.
Unfortunately, antibiotics are not benign things.
Dr. Donald Ford from Hillcrest Hospital and a member of the group called Better Health Greater Cleveland says the antibiotic issue is one of many concerns you need to talk to your doctors about.
I can do a whole bunch of tests. I can order, go down the list and check off every single thing. Is that going to be good for you? Is that going to help me get to the heart of what's going on with you?
I teamed up with Consumer Reports for a list of questions you need to ask your doctors before undergoing tests or screenings. 5 of those on your side must ask questions include: what are you looking for? What is the test likely to show? What if it's positive? What are my options? Can we put this off? The medical director for Consumer Reports, Dr. John Santa, says everything from imaging tests on back pain after a fall,
even though we know 90% of the time people will be better in 4 to 6 weeks without doing much of anything.
to ovarian cancer tests.
Sad to say that the blood test and ultrasound for ovarian cancer, not a good screening test. Sorry, we all wish that we had a good screening test for ovarian cancer. We don't.
To screenings for heart disease without major symptoms.
The chances of those heart tests showing anything that's significant are very low. In fact, it's less than them having a false positive.
Are tests that are ordered, but they shouldn't be.
Unfortunately, some consumers and some physicians believe that any screening test must be good, and it's quite simply not.
However, legal experts say caution is needed.
Don't offload the risk onto the patient.
Cleveland attorney Tom Merriman tells us no one should be against the elimination of unneeded tests, but you as a patient should examine who's behind those recommendations. Are insurance components involved?
If the doctors are saying that's an unnecessary test, I'm all in, okay? Let's just make sure that the people who are making these decisions are not people who are making it based upon their own bottom line.
Consumer Reports says these are 3 tests that you or your loved one should get: cervical cancer, colon cancer, and breast cancer.
Holding ourselves to a higher standard of evidence.
Metro Health Medical Center's Dr. Randall Siebel is the director of Better Health Greater Cleveland. He says the American Board of Internal Medicine and 50 other medical societies agree that patient education is key. And as part of Better Health's Choosing Wisely program, doctors are getting more informed about testing and treatments such as antibiotics.
We really need to know more about both the side effects of the medications that we're prescribing as well as the evidence of benefit should we prescribe them.
And after being prescribed all of her medications and having surgery, Christine's mom is doing just fine. But Christine hopes her mom's ordeal is a wake-up call for doctors and especially you as patients.
In order to actively participate in making the best healthcare decisions for them.
A powerful message, no doubt. So here's a reminder for you guys. Top 3 tests you should get: breast cancer, colon cancer, and cervical cancer screenings. The on your side bottom line here, folks, is have an educated conversation with your doctors. Don't be afraid of asking questions.